Welcome back to Great Day. More than 5 million Americans are diagnosed with heart valve disease each year. Our next guest, specialized in a minimally invasive treatment, can correct a leaky valve and get your heart back to pumping normally. Cardiothoracic surgeon Dr. Nguyen with Hermann Memorial City Medical Center is back with us to show us how it works.
Thank you, Deborah.
And before we get to this specific procedure, it's amazing to me what's happened when it comes to any kind of cardiac surgery, right? Is that they used to say, like my dad was 80 years old, and they said, let's just make him comfortable, and he would pass away. But at 80, they looked at him and said, the rest of his body is in great shape. We're going to do a quadruple bypass on him. So giving him 17 more years of life.
Absolutely. We've made a lot of advancements in medicine, especially in cardiovascular diseases, and patients who are 70, 80s, and sometimes in the early 90s are still considered relatively good surgical candidates. In the past, you're right, a lot of times these patients, we'd sit back and say, hey, these patients are too high risk, but now these patients are very high risk and very low risk and very functional and have good quality of life.
In fact, you mentioned my mom had heart surgery at 94.
Absolutely.
You know, and she's 96 now, and she's still feisty. Okay. Heart valve disease can encompass a number of things.
So the valve does several things. The valve allows blood to flow through, but sometimes things the valve can do is it can become stenotic, or it becomes tight so blood can't go through, or it become leaky. And those are the two most common things that happen to the heart valves. The two most common heart valves that get affected for patients are the aortic valve and the mitral valve. And those are the two most common valves I operate on.
What are the causes of those problems?
So for the aortic valve, the aortic stenosis, as we call it, a tight aortic valve, the most common cause is actually old age. So eventually, as patients get older, you have calcium buildup on the valves, and they get tight, and they don't open up as well as they should. The mitral valve is just wear and tear. So the most common cause for mitral valve becoming leaky is wear and tear, where the valve, oftentimes the cords of the valves will rupture and they will kind of flap around, and then the valve becomes very leaky. The way I look at it, it's like a car, right? So you want the car to run efficiently with gas and be super efficient. But if it leaks, or if it has to push through a tight hole, then the car engine has to work so much harder, and eventually with time, the engine fails sooner. And sometimes the car is not working, you don't even realize it until it starts to fail. So that's really important.
And to that point, if you don't even realize that it's having that problem, what are the symptoms? Because most of us will show up to the doctor when we're dealing with something like a heart, we'll show up in crisis,
Absolutely. You know, sometimes you don't have symptoms, so that's why it's important to really just do a checkup and make sure your doctor can listen to your heart and lungs to catch things that you might not actually know yourself. But the common symptoms for a leaky or a tight valve are you get short of breath, you get tired easily, you might have some chest pain, or you might faint, or syncopize, as we call it in medical terms.
When someone says heart surgery, I think a lot of us picture cracking open the chest, We don't always have to crack open the chest anymore. And when we say minimally invasive, that is good for all kinds of reasons.
Correct. So when we operate on the valve, we really just need to expose the valve. And traditionally, when people operate on the heart, they expose the entire heart, but they're focusing on just one part of the heart. So what we do here at Memorial Hermann is we focus on exactly what we need to fix, and because of that, we make small incisions to be able to just address what we're going to fix. Patients who have minimally invasive surgery have a faster recovery. There's a lot of data to show that they have a decreased need to require blood transfusion.
Risk of infection.
Risk of infection. They spend less time on the breathing machine. They get home faster. But more importantly, the way we look at it is we want people back to their normal cells and better, and return to their kind of original quality of life, if not better.
Because that's I think a thing that's fearful for a lot of people is what's the recovery like?
Absolutely. So the recovery is much faster with the minimally invasive approach. It's key when you go to a surgeon, ask them if they do minimally invasive valve surgery or minimally invasive heart surgery. It's not.
Another procedure you all do, and my mom had moved here. I moved here from San Antonio, and they said that she had 6 months to live, and she kept living, and she kept living. She goes, well, clearly they were wrong. She was But when I ended up taking her into Memorial Hermann, they said, have you ever considered the TABR? And I had not heard of that before. She was dealing with congestive heart failure, and they looked at it and they said, we can fix this. This is not 6 months to live. We can fix this. And so TABR is another thing that you all want to get the message out of what you can do.
So TABR is pretty phenomenal. So instead of having to open up your heart or open up anything, we're able to replace heart valves, do a small incision in the groin, and replace the aortic valve. And patients stay in the hospital for 1 or 2 days. I'm not sure how long your mom was in the hospital for, and return back to normal function really quickly.
And it was crazy because I literally, during the surgery, she was actually having a conversation with them. She's like, well, now what are you doing again? What did my daughter put you up to again?
Well, you're exactly right. So we do it with patients awake, which is amazing. You're doing heart surgery with patients partially awake. That's pretty incredible.
It is. All right, so treating a leaky valve. And again, when we say leaky valve, what's happening right there, and how can we treat it today as opposed to what we used to do?
There are a couple ways to treat it. A leaky valve is, again, when your heart squeezes, the blood should go to the rest of your body, But if you have a leaky valve and the heart squeezes, Some of it goes to the rest of your body, but a lot of it goes backwards into your lungs and into the in the wrong places. So we fix it once surgically through a minimally invasive approach, and we can either repair or replace it. It's always better to repair if you can. Another new technology that's very innovative and transformative is a mitral clip, and that's a way to repair the valve through the groin as well, similar to the TAVR that your mom had, but a different valve. So a mitral clip or minimally invasive mitral valve repair is the best way to do it.
Yeah, heart disease is still the #1 killer around the world of men and women around the world. So to your point earlier, go in how often? And how much can you tell just by putting the steth up to our chest?
You can tell pretty easily. You know, you put the doctor will listen to your chest and listen to your heart, and if there's a murmur, then that suggests you might have a problem with your valve. So a murmur is any disturbance in flow, and you should be able to pick that up very easily with a stethoscope.
Yeah. All right, we're talking to the commercial break, so I know you said this is a long answer, so give us the TV answer. In medicine, why did you decide to deal with the heart?
So the heart feeds the rest of the body, right? And a lot of the operations we do with the heart require a fair amount of technical precision. Some of the sutures we use are smaller than your hair follicle. And we use these magnifying glasses to magnify and be able to do bites that are probably at the 1 or 2 millimeter level. So for me, from a technical standpoint, it's very, very rewarding. But more importantly, it's your heart, right? And it feeds your entire body. So I think that's kind of very rewarding to me. You know, we operate on patients who are 80, and we stop the heart. And what defines life in some ways is, you know, we look at that ultrasounds, like, hey, that patient, you know, you see that little baby with their heartbeat, right? And from that time until they're 80, the heart's been beating nonstop. But for the first time, we actually stop the heart to fix it and bring it back, which to me is pretty incredible.
Yeah.
Incredible.
Dr. Cooley, when he said, he goes, you know, when you talk about the heart, because a lot of times people say the most important thing is your brain.
Right.
He goes, but until your brain gets its blood supply and its oxygen, so the heart is
the heart
in
feeds
that
the
way,
brain.
the center of so many things.
Yeah.
All right, Dr. Nguyen, thank you very much.
Thank you so much.
To book an appointment with Dr. Tom Nguyen and for more information on Memorial Hermann Memorial City Medical Center, call 713-222-CARE. That works out to be 713-222-2273, or visit heart.memorialhermann.org.